Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up this week, if you think you're too young to worry about your cholesterol, you might want to think again. A new study in Circulation, the Journal of the American Heart Association, shows for every decade when your cholesterol is too high, between ages 35 and 55, you may increase your future risk of heart disease by 39%. Holly, tell us about this study.
So the researchers looked at data from about 1,500 people at age 55. Now, these people did not have heart disease at that point. Then the researchers looked forward 20 years and backward 20 years. Ultimately, they found that if you had high cholesterol, even slightly high cholesterol, for a decade or more, between the ages of 35 and 55, your risk of heart disease really skyrocketed.
So if you are otherwise healthy in your 30s, say, should you be worried about slightly high cholesterol?
You know, Anthony, to me, this was the most striking aspect of this study. High cholesterol seemed to have an even bigger impact on the people who were otherwise healthy. So these were people who had normal blood pressure, no diabetes, they were a normal weight, but having high cholesterol still dramatically increased their risk of heart disease. It's an independent risk factor.
You mentioned 35. Is that the age when we should start getting our cholesterol checked then?
Well, the American Heart Association suggests that you start at age 20 and then repeat it every 4 to 6 years or so. But that's a general guideline. If you're somebody with a super strong family history, you may want to think about starting it sooner.
But how does someone know if they need treatment?
This is the million-dollar question that people argue about. There's no question that if you are somebody who's had known heart disease, you should probably be on a statin then, unless there's a reason not to be. And then there are calculators that figure out your 10-year risk of having a heart attack or stroke. And if that is 7.5% or higher, you should strongly consider a statin. And if your LDL, that's the bad cholesterol, is 190 or above, again, strongly consider. Then there's this vast middle ground, say 2.5 to 7.5, in between a lot of people, middle-aged, their cholesterol is a little bit elevated. That's an area of controversy where people say, look, talk to your doctor about your individual risk benefit profile, but I can tell you that a lot of people out there in America are taking statins in that group. It's sort of a national experiment we're doing. We don't have the data to prove that it actually does help you.
Well, a neurosurgeon is developing a unique diagnostic tool for concussions. It can be used in the emergency room, and someday he wants to have it on the sideline during a game. John?
That's right. The CDC says there are about 2.5 million emergency room visits every year that are associated with traumatic brain injuries in the United States.
51-year-old Dirk Kaufman was riding his bike last March when he was hit by a car. He wound up in the emergency room at Bellevue Hospital.
What was the first thing you thought when you woke up?
What the hell happened?
What happened was a concussion with memory loss and confusion. In Kaufman's case, the injury did not show up on a CAT scan. But less obvious cases of concussion are harder to diagnose, says neurosurgeon Dr. Uzma Samadani.
Concussion actually has 43 different definitions, and that's part of the problem, is that nobody knows how to define it, and therefore nobody knows how to diagnose it or count the incidence of it.
One more time around.
Samadani and her team at NYU's Cone Veterans Center are developing a way to diagnose concussion by measuring how the eyes track a moving image. In this case, an animated movie clip. 97% of healthy people move their eyes together at a very predictable rate. Today's study found emergency room patients with symptoms of concussion had problems with eye tracking, even when their CAT scans showed no evidence of brain injury. The study also found the more severe the symptoms, the more abnormal the tracking.
Haven't cartoonists known that for years, that if you get bonked on the head,
yes,
they draw the characters, their eyes are going this way or that way?
Yes. So Wile E. Coyote is the classic example of the cartoon character who gets hit on the head and has abnormal eye movements. And that's how you sort of diagnosed concussion in the 1950s when Wile E. Coyote was created.
One problem is injured athletes can downplay symptoms in order to keep playing.
I think this is really important, that there's an objective measure. You can't fake whether or not your eyes can move together. If someone has a brain injury, you're going to be able to detect it.
Wile E. Coyote, huh?
Yeah.
So what is the next step for researchers?
Well, this is still in an experimental stage. It's not FDA approved. And these were people who had obvious symptoms of concussion. The next thing is going to be, can you pick up subtle symptoms? Because the real danger here with concussions, you have that initial one, but the person denies it, say, or they don't realize that they really have a concussion. They go back and they play again. They get that second concussion. That's the one that can really do damage.
There's new evidence that some common household chemicals, cosmetics, and plastics are connected to the early onset of menopause. A study found the effects on women's hormones could speed up menopause by almost 4 years. Holly, what is the average age of menopause in women?
The average age is around 51, and this study found women who showed high levels of exposure to these specific chemicals, their menopause speeded up. They had it 2 to 4 years before that average. Now, this wasn't a cause and effect study. It was just a link, but it's still significant.
So what chemicals are we talking about here?
The researchers really found 15 were worrisome. Some are in a group called PCBs. Now, these have been banned since 1979, but they're still in our environment. You can find it in the bloodstream, and you can find it in our soil. Some other chemicals, there were a few pesticides that were concerning, and something called phthalates. Now, those are found in plastics and a number of household items like cosmetics, even liquid soaps.
What are the products, though, John? Is there anything that we might have in our cupboard or our medicine cabinet that we should be aware of?
Well, Holly mentioned these are really everywhere. They're in plastics, they're in food and drink packaging, water bottles. And I have to say, I'm glad you mentioned it's not necessarily cause and effect, and it's a link, because I know, this has been controversial out there. There certainly has never been proof that it definitively causes this or that, but there has been this link and enough scientific evidence so that there's reason for concern, and some lab animal data. So I think out of an abundance of caution, people should, if they can, try to avoid it. It makes sense. For example, BPA is one of these chemicals, and it's in bottles. So you can get a BPA-free bottle, especially a baby bottle, and don't microwave things that have plastic in the plastic containers, things like this. And look at labels, because it's not always in the label, but wherever you can, check out the labels.
Finally, could the Super Bowl be decided by whether game time is in sync with an athlete's body clock? It might, according to a study from Britain's University of Birmingham. Researchers analyzed the circadian rhythms of more than 120 athletes. They were classified as early, intermediate, or late risers. Then the athletes completed fitness tests at 6 different times of day. And what did they find?
I think they found that if ever I'm going to start playing football, I need to do it just at 10 a.m.
Right.
Basically they found that performance really varies based on the time of day, up to about 26%. Some people are early risers, some people mid, some people late, and you do better if you're playing football at the time that's best for you.
And the take home was that it's not the clock on the wall, it's your internal clock that matters.
Right.
And so if you are somebody who's going to do an event later in the day, but you're an early riser, then maybe arrange your sleeping pattern so that when you get up,
It makes me think I could be such an amazing anchor if this show was just a little bit later in the day.
Just adjust your bedtime as you are doing.
Yeah, if they could just have the morning show at lunch, it would be great. All right, Dr. Holly Phillips, Dr. Jon LaPook, thanks very much.